about parenting, and it's obvious that every parent desires for a happy child, and every parent has this feeling that how can I make my child into a best and a happy one. And I sometimes in my practice see how the parents interact with their children, and I really enjoy watching them, the drama that happens between the parent and the child as they argue right in front of me so often. So I wanted to try and make some sense out of parenting to see this vast subject, but what can I give you in this short 10 minutes that can practically help you the moment you land in your home. So let us see the next slide, please. So when we deal with the child's behavior problems, practical problems that you see in your home every day, one of the things that I see very often is a lack of proper guidance in communication skills. So one can divide a problem into three aspects. First is a behavior of the child which causes child a problem. You can say that child owns this problem. The second is a behavior that causes parent a problem. So you can say parent owns a problem. And there is an in-between that is a no problem time. So we want to see how we can increase the no problem time and manage the problem that the child has and manage the problem that the parent has in an effective way. So when we look at first the behavior causing parent a problem, that is the parent owns the problem, here you see that there is a direct interference in the parent's right, and it prevents the parent from getting their needs met. For example, I am very tired coming from my home, and my child is shouting loud, watching television loud, is speaking loud, is enjoying himself. Obviously, it is a big problem for me in that moment. Now, how do you handle this situation? What is recommended? Next slide, please. But there are two kinds of messages that you can send to your child. One is, you stop please making this noise. You have been naughty all the time. You messages. You know, all the time I see parents come to my clinic and do you. कभी ना कभी ये you करना बंद करना है. Because the you messages directly attack the child's ego. You stop pestering me, you stop being a pest, you are acting like a baby, you go to your room, you stop making the noise, you don't, I will spank you, you are being careless, you want attention. You can see the message that we send our children is you. Next slide, please. What can be an effective substitute for this is an I message, where you say, I cannot take a nap with so much noise around me. Can you see the difference in how you have communicated? What needs to be communicated to the child is not that you are like this, but I am getting disturbed. I am upset with my kitchen getting messed. I cannot hear anything on the television. There is so much noise. I am afraid you will fall. Here you can get in touch with your own feelings by examining what is the effect of the child's behavior, either commission or an omission, how it affects you, and how you can effectively convey this to the child. So each time before you verbalize, you for a second ask yourself, what is this causing me? and convey that to the child. Do not expect to change or manipulate your child's behaviors to suit your beliefs and moods at all times. Now here I'll give you a little example. In my clinic, once I was just with a child and a mother, and I know that myself and this patient are having a lot of difficulties with this behavioral problem of this child. Just go 15 seconds fast. Yeah, that's it. Just pause there. Wait. And there, when I was counseling the mother in the end, this child was a very attention-seeking child, and very, very often mother found it very difficult to censor her or stop her from doing what she is doing. Often she had to be physically lifted from a non-acceptable behavior out of the room or out of the scene. So it so happened during this session, just watch, it is a half-a-minute clip.
Is it going to cause damage to the sister or to people around, or is it going to cause damage to you? So whatever that damage is, you can say very loudly, this is the damage, and this damage is unacceptable.
You can see. One thing I would recommend, made in India weighing scales. They never break. So many children have jumped on my weighing scale, it's still the same for 20 years. Okay. Now you can see the child was looking at the mother.
Find that she's not causing any problem to you or to others, and it's not worth it, don't make any. Okay? So listen to her, gradually say I understand and don't feel this company. This is my weighing scale can break, really I'm telling you.
So what did I tell her? I told her my weighing scale can break. Did you see? I did not judge her. I did not accuse her. I did not really scold her. I did not give her any you message. I gave a message that I am a homeopath, I am poor, I cannot afford a new weighing scale every day. And you can see how the child immediately reacted with sensitivity. This way I have created a responsibility in the child to be sensitive to my feelings. And the child has understood the reason for not jumping on the weighing scale versus you. Can we have the slide, please? Now let us go to the next set of problems. This is a set of problem when the child owns the problem. That the child says, I don't want to go to the school today, and he makes a huge tantrum, or the child has a problem with his friend, or the child wants to eat an ice cream, or it is essentially a child's problem. That the child is very upset that he has had a fight with his friend, or the friend has stopped talking to him, or he doesn't want to go to the school, or Hindi teacher is a big problem. Anyway, Hindi teachers are a problem. My personal experience. So here the child needs are not met, and the child is unhappy and frustrated and in trouble. Here the child is in distress. In the first case, the parent was in distress. So how do we handle a problem where the child is in distress? And a wonderful tip was given by Dr. Anand, that one of the most important things when the child is in distress is very simple. The only don'ts would be that usually the parents have a tendency to jump in and start advising the child. The parents start taking responsibility for the child, as if you are there to solve the problem for the child, or the parents start blaming themselves, or they start blaming the child. So let us see what can be the answer to such a problem. First, we need to understand that all children will encounter problems in their lives. Pre-packaged solutions by parents only make the child dependent, and they never learn how to solve their own problem. All kids have an untapped potential to find their own solution. The best solution is the one that comes from the heart and the logic of your child. How can we facilitate that solution that comes from him and not from you? When parents accept and does not own the child's problem, then he or she can help the child work through the problem solving process. Next slide. There are two most effective strategies. And the first strategy that I teach in my parenting seminars, we spend one day only trying to learn skills how to listen, and then listen, and then listen, and then listen, and then full stop. Usually what happens, there is a short listening and immediately it's followed by yes, but. The moment this yes, but comes, the child shuts. After the yes, but is arguing about the illogic in the child's emotions, in the fears, in the stubbornness of the child, in the desire of the child, the moment you say yes, but, the child shuts into a sulking and he starts harboring that I am not being understood. So what is very important is lot of patient listening, especially when the child is upset. If you have the power, the patience and the love to listen, I can tell you half the problems get solved by listening. We as homeopaths are successful more than allopathics in some ways is because we listen. And I have seen by listening, lot of problems can be solved. What does listening do and what is the purpose of listening? Listening creates a deeper insight into the problem. Listening encourages the child to delve deeper into the issue, helps the child to understand himself, herself. Listening brings and it opens doors to awareness. In fact, we used to have groups of parents come to my clinic and we used to share how listening changed so much between the parent and the child. Today, as Dr. Anand said, there is so little time and patience that you messages are fired like like this. And very less often the parent shares his feeling with the child, saying that I am feeling disturbed. What is happening to you? Please tell me. That way the parent is able to express her distress to the child and child express her distress to the parent, and this can create what is understanding. What is very significant when it comes to dealing with child's problems is understanding. When you are very upset, whom would you like to meet? Would you like to be with a person who makes you understand, gives you lectures, tells you what is right, what is wrong, how to do it, why not to do it this way, do it that way, you are wrong, this is right? Would you like to be with such a person when you are upset? Or would you like to be with a person who understands you? Ask yourself. The answer is clear. The child also wants to be with somebody who can understand him. And the moment you listen to the child, the chances that the child will listen to you when you are upset will also increase. So the message is to be a listening, understanding parent. Next slide. The last and the most fundamental message, and this is what is missed out by all parents, is their struggle all the time is with the child. And the approach is so child-centric to make the child happy. But they never think that my child deserves happy parents. Every child deserves a smiling, harmonious, happy parents. So it is very fundamental right of the child to see you not scared like this when she is having fever, or not having to see you shout loud at your spouses, not having you shout loud at your business associates over the telephone. Your child, as Dr. Anand rightly said, that the fathers need to spend a no problem time with the child. That the child, every child has a birthright to have happy parents as much as every parent desires a happy child. So it is very important that we work and take responsibility for our own happiness. When we are happy, only then we can make our children happy. This would be my message for the day today. The last slide. As it is said in Lao Tzu, if you want to awaken all of humanity, then awaken all of yourself. If you want to eliminate suffering in the world, then eliminate all that is dark and negative in yourself. Truly the greatest gift you have to give is that of your own self-transformation. When you transform, everything around you has a potential to transform. And that is where homeopathy plays a very big role. It's a holistic science. It helps you to understand yourself and heal those unhealthy patterns within your own self so that you can be spontaneous, enjoy unconditional love, and be like a child with your child. That is the secret. So before I thank you, I want to show you one 3-minute song. This is a song that was sung for the mothers, the state of the mother. It's a wonderful song. It's just a 3-minute song. Just play.
Would you just play fair, be polite, make a friend, don't forget to share, working out each term, never take get along. Don't make me come down there, clean your roof, wash your clothes, put your stuff away, make your bed, do it now, do we have all day? Were you born in a barn, would you like some hay? Can you even hear a word I say? Sir, let's all get off the phone. Don't sit so close, turn it down, no texting at the table. No more computer time tonight. Your iPod's my iPod, if you don't listen up. Where you going in with whom and what time do you think you're coming home? Say thank you, please, excuse me, makes you welcome everywhere you roam. You'll appreciate my wisdom someday when you're older and you're grown. Can't wait to have a couple little children of your own. You'll thank me for the counsel I gave you so willingly, but right now I'll thank you not to roll your eyes at me. Close your mouth when you chew, would appreciate. Take a bite, maybe two, of the stuff you hate. Use your fork, do not burp, or I'll set you straight. Eat the food I put upon your plate. Get an egg at the door, don't start with me. Get a grip, get it here, I'll count to 3. Get a job, get a life, get a PhD, get a dose. I don't care who started it, you're grounded until you're 36. Get your story straight and tell the truth for once, for heaven's sake. And if all your friends jumped off a cliff, would you jump too? If I said it once, I've said at least 1,000 times before that you're too old to act this way. It must be your father's DNA. Look at me when I am talking, stand up straighter when you walk a place. For everything and everything must be in place. Stop crying or I'll give you something real to cry about. Huh. Wash your face, brush your teeth, put PJs on, get in bed, give a hug, say a prayer with love. I love you. The reason why, because I said so, I said so, I said so, I said so. I'm the mom, the mom, the mom, the mom, the mom.
I just want to end this with a prayer for a happy child and an even more happier parent. Thank you.